My 43-year-old patient just found out she's pregnant. And I love celebrating wins. You all know that. So I want to celebrate this big win for this patient who found out after a very long road with secondary infertility that she was finally pregnant at 43. But I also think it's important to talk about the road that it took to get there. So this is a patient who had recently moved across the country to New York City. She previously lived in a different state, and she had dealt with a long-standing history of primary infertility. She had dealt with an 8-week loss, a ruptured ectopic pregnancy, had to have her tube surgically removed. She had gone to a clinic where she was living and had done at least 6 rounds of medicated IUIs, and then a bunch of IVF retrieval cycles where they froze all the embryos at day 3 and did not do any PGT testing, and then had 3 failed frozen transfers of single and double embryos at a time at the day 3 stage. And then lo and behold, doesn't make any sense, but she ended up conceiving on her own without medical assistance and was able to have her daughter, who is now 3. And she then, went on to start trying and, has been trying for the past 2 to 3 years, and knew she was moving out of state. So really hadn't consulted with anyone about trying to conceive baby number 2, and came to me and said, look, I have these 4 remaining day 3 embryos that are frozen and stored at my prior clinic. And they were made when I was in my late 30s, and now I'm 42, almost 43. Doesn't it make sense for me to at least try and see if I can be successful with those embryos? So I said, that's reasonable. And we transferred them over to our clinic. And because they were at the day 3 stage, we didn't really know where we stand with those embryos. And we thawed them out, grew them to the blastocyst stage, and one really made it, and we were able to transfer it. And unfortunately, it didn't work. So we were back to square one, starting from scratch at age 43, which is kind of a daunting proposition. Her AMH at the time was borderline, not very low, but around 1. And I recommended that we use PGT this time around, knowing that the rate of chromosomal errors in embryos coming from her 43-year-old eggs is anticipated to be around 80%, which is very high. And so in order to maximize the efficiency and reduce the risk of miscarriage, we decided to do IVF with PGT. Let's run through what happened when we started IVF. Every cycle, I used conventional doses of medication to be appropriately aggressive. First cycle, very low response, canceled. Second cycle, 4 eggs were retrieved. Obviously, we had changed the protocol and made some tweaks. 2 of those eggs were mature and fertilized. Unfortunately, none of them grew out to the blastocyst day 5 to day 7 stage, and that cycle ended. In the third cycle, we utilized the same protocol as cycle 2. 5 were retrieved, 3 were mature, only 1 made it to testing, and it came back aneuploid or abnormal, meaning this is not an embryo that we can transfer. The 4th round, we used a similar protocol. It was one of our more aggressive protocols for low responding patients, and she had 8 eggs retrieved, only 2 of which were mature, which is not optimal, and none of them turned into embryos. And then we did a 5th cycle, and obviously there was a lot of counseling between cycles in strategizing and figuring out next steps. 9 eggs were retrieved, 6 were mature, 4 fertilized, 3 made it to the embryo stage as a blastocyst and made it to testing and were frozen. And get this, 2 came back normal, euploid, at day 6 and day 7. So at this point, we're elated and so happy that we finally have something to work with. I do a saline sonogram, uterine cavity looks perfect, and lo and behold, the first frozen transfer worked. And we found out about that last week, and the numbers are looking great. And that, my friends, is what I mean when I say persistence pays off. This is a patient who obviously has insurance and was able to do multiple rounds. She is an educated person who works with a background in science, and she really understands what's going on. And we have a great doctor-patient relationship, and she has felt really comfortable and confident with me, the team, and the plan. So while many people in this type of scenario could get burnt out, I think having support and feeling confident in the plan is what has really helped her to stay the course and keep going. Infertility and treatment to overcome infertility is a marathon. But I truly believe that with the right steps, some tenacity, and having a strategic approach, it is possible to overcome even when the odds seem really stacked against you. So I hope hearing this story gives you hope and brightens your day, because it definitely made my week.